Hi again, folks. So we're here to talk about beta blockers in heart failure. Now, there's lots and lots of beta blockers. They've been around for a long, long time. They started off treating things like tremors and high blood pressure or tachycardia, so faster heart rates and slowing them down. But in later years, then there was research that pointed to specific formulations of beta blockers that were then proven to actually improve survival in heart failure, and quite dramatically. Originally, beta blockers were stayed away from because they were used in very acute heart failure. So patients that were very, very sick, they'd come into hospital filled with fluid in their lungs and they couldn't breathe. And if beta blockers were given in that acute scenario, they did worse. So for a long time, we thought, well, beta blockers are a bad thing. And certainly in acute heart failure like that, where patients are what we call decompensated or unstable, it wasn't a good thing and they didn't do well. But we learned that there was a more controlled way that you could deliver beta blocker treatment, and we could do it at a later stage in management when patients were more stable, when they weren't acutely unwell and short of breath. And ideally, they are delivered in patients who have had their what we call fluid state optimized. So they don't have excess fluid in their lungs. They're not particularly short of breath. We do have to watch beta blockers in the setting of things like asthma, where patients are wheezy, because we do know that most beta blockers will exacerbate asthma. They will make it worse. They will make you wheeze and they will make you more short of breath. There are some situations where beta blockers will still make people feel unwell and have side effects too. They can make you feel fatigued or breathless, even in the absence of asthma, ironically. But for the patients who tolerate beta blockers, they can really turn things around in heart failure. So after the ACE inhibitors did their stellar introduction to changing death rates in heart failure, the kind of next major group to prove their worth was the beta blockers. And these were extended release metoprolol, for example, dilatrend or carvedilol, and bisoprolol, nebivolol. There are a number of them. Anyway, what are the beta blockers? What do they do? Well, what they do is they block the beta receptors in the heart and the vascular system. And what these do is down-regulate the effects of the catecholamines in the body. These are like the adrenaline type hormones, the fight-flight hormones, if you like, that are upregulated when the body is stressed and upregulated in heart failure. So heart beats faster. They're trying to increase the blood pressure, but maybe not effectively. And in increasing heart rate and blood pressure, they're trying to improve cardiac output. However, in the short term, that might work very briefly, but then what happens is, as the body is compensated and still under stress, what happens is it's like the heart develops a level of fatigue and fails in that situation. Then the beta blockers are there to try and calm this down. So they will slow heart rate. They do lower blood pressure, so obviously we have to be quite careful in administering these drugs and do it slowly over time, again, when the patient is not acutely decompensated or unwell. And, very carefully add them in to modify that fight-flight system and allow them over the longer term to do their thing, where they have a positive effect on survival. Again, these drugs aren't going to make you feel better necessarily. These are to benefit your survival. And so we have to balance when we're introducing these medications against what side effects or adverse effects you might have as they're introduced. Some people don't have any adverse effects from them. They tolerate them very well. But again, you know, the smaller the dose that you introduce them at and the gentle approach to applying them and then titrating them up or increasing the dose, you can find that a lot of patients will tolerate these quite well. Some not at all, but you know, I think it's very important that as heart failure specialists we try, unless there's a good reason not to, because again, the maximum tolerated dose, the maximum number of heart failure medications lead to the best results long term. So you might be on a beta blocker or you might not be on a beta blocker. And if you're not, it's worth asking your doctor why that is. There's probably a perfectly good reason as to why not. They will have thought very carefully in the choice of the medications that they've given you individually, and everyone is a bit different. But, you know, just again, for educational purposes, this type of medication, these groups of medications, the beta blockers, are a important step in getting you the best outcome possible, the best survival possible. And there's lots of drug trials that support that. So that's the group of drugs called the beta blockers. And so next to the ACE inhibitors, which were first up, angiotensin converting enzyme inhibitors, and then beta blockers, but the heart failure ones, not the regular beta blockers. And your specialist will know the difference. So, you know, that's sort of the step 2 in treating heart failure. Again, depending on causes and tolerability. Everyone's different. So, you know, if you have questions about your treatment, please ask your doctor or ask your heart failure specialist. And if you haven't got a heart failure specialist, ask your cardiologist, general physician, or whoever is taking care of your heart failure wherever you are. And, you know, please subscribe to the videos if you want to know more about heart failure. On a journey with you to try and help educate you guys, so that you have a better understanding of what it is that's happening to you, what it is you can do about it, what your doctors can do about it. And I really just want to help you on your journey so that you don't feel overwhelmed and bamboozled by the whole thing, and that there's good opportunity for you to speak up and make sure you get what you need to do well. So please join me on the next video, and we will cover off on the next group of medications that are used in treating heart failure. Thanks very much.